So you're thinking your loved one might need some assistance, but you're not sure where to begin. I'm going to share 5 tips with you on how to begin your journey in setting up home care right now with Griswold. Step 1, contact us. Call us or fill out a form online. Tell us a little bit of basic information about yourselves. If you call us, we're going to pick up the phone and talk to you and ask a few basic questions. So be prepared for that, to tell us the situation with your loved one. What do they like? What are you struggling with? What are your needs? And if you fill out a form online, just put basic information, some contact information so we can reach out and have that discussion about what you think you're looking for, what do you think your needs are. After we talked a bit, if you feel comfortable with it, we'll schedule a time for us to visit face-to-face. That gives us an opportunity to assess your loved one, see what they're capable of, meet you, give you a level of comfort and peace of mind with who you're working with, and give us a deeper insight into what a day of care might look like for your loved one. Step 2 is to meet each other. We'll come to your home. There's no obligation for this, no cost. It's just time for you and us to meet each other and hopefully gain a level of comfort. It's meant to be an informative situation. You'll be given the opportunity to ask any and all questions that you want to ask of Griswold, how we do things, what our process looks like. Tell us about Griswold's operation, who we are, what we stand for, what our mission is, those things. Are our caregivers trained? What are our systems like in our organization? And it gives us an opportunity, along with our nurse, to ask your loved one questions about what they're capable of, what are they struggling with, can they ambulate, do they need a walker or a wheelchair, are they bedbound, do they take bed baths, showers, are there pets in the home, and many more other questions to give us a level of understanding. You know, after 10 years, we've met with a lot of wonderful families and we've learned of many different situations. And so we've seen quite a bit and can hopefully help you move from where you are to where you think you want to be. Step 3 is to create your care plan. If you're comfortable with Griswold, if our answers were satisfactory to your questions and you want to move forward, we'll then begin together constructing a care plan about what a typical day might be. What are the tasks that are needed? When is the schedule to be? What time does your mom or dad wake up? Are they an early riser like 5:30? Or are they a late sleeper like 11 a.m.? You know, when should we begin the shift? And what are the first things that we'll be doing when we get there? What are their likes? What are their preferences? Do they prefer strawberry jam or grape jam? Do they like toast with their coffee or something else? So we'll discuss these issues along with, of course, the important reasons you want us there, like keep mom safe. She's a fall risk. Make sure she's using her walker. If she ever stands up from her chair, make sure you have hands on her. Give her the things that she needs. We feel like she's been losing some weight and we want to make sure that she's eating and taking her meds. Together, we'll build this plan that fits your loved one's needs and their lifestyle. Step 4 is take care of business, the things that are required to begin providing care. That includes some simple paperwork. As a state licensed agency, we have to complete some state forms, some HIPAA forms, and an agreement. And the agreement says that anyone in this relationship can stop services at any time with a 48-hour written notice. Of course, if you have questions along the way or preferences, or you want to see or use a different caregiver, call us, let us know that, and we'll make changes upon your request. We'll discuss payment options and how our process works, and so that you're clear and transparent on everything that's about to happen. And step 5 is to begin care. We'll pick a start date together. We'll have the schedule, shift time, beginning and end, and how many days per week. And on that designated first date and time, our caregiver will show up, and that caregiver will be prepared with a care plan, the care plan that's been created by our nurse and us in the home with you, that you have a copy of. And we can modify that as we move forward, and maybe your mom's needs change a little bit, or you have other preferences as you see how well it's going, but you want to add a few things. That's okay. Just call us anytime you like, and we can add that into our care plan. But that care plan is visible in the smartphone of the caregiver in the app, the Griswold app. So the caregiver comes into your home knowing what your loved one's needs are, what the care plan is that we've constructed with you. So, and you have a copy of it, and we can modify that as we need to. So here at Griswold, we can begin very, very quickly if we meet with you on one day, depending on the level of care that you need in the situation. We could start as quickly as 24 hours, sometimes even sooner. We like to have, if it's not an urgent situation, we like to have a couple days to put it together so that we can make sure we have the best match for you and your loved one, so that you have the peace of mind that your loved one is safe and being taken care of, and your loved one is enjoying the experience. So those are our steps. It all begins with a phone call. So if you're having these conversations with your spouse or siblings about where do we begin, give us a call here at Griswold. The number's down below in the description, and we'll discuss what your needs are, what your preferences are, and we can begin very quickly. Thanks for watching.